Hola everyone, welcome to Flexibility Script. This video is going to be going into some things to help our knee joint. And this first release is like a self-massage technique that ends up helping the tissues along the calf and hamstring, like the origins and insertions of both, and the ball is actually placed in the knee pit area. So it's a bit of a two-in-one, and one of the things about this self-massage technique is that it ends up having an effect on terminal knee extension, meaning the ability to fully straighten that knee, almost to help lock it out. Usually if you're coming from the dance world, sometimes there is talk about trying to get rid of the micro bend, where that knee is straight but it has that little bit of a bend to it. This mobilization I usually find is one of the things that really helps improve that ability to get that full knee extension and get rid of that micro bend. So again, terminal knee extension means the ability to fully straighten and lock out the knee will be improved with this mobilization. So you can use a lacrosse ball or a pinky ball. A pinky ball is just a softer ball, and then the lacrosse ball really has no give. Either one will work well. This one may feel a little bit more spicy, and this one will be just a little bit kinder. I'm going to go on the kinder side, and I'm going to be taking that ball and I'm going to be placing it on my knee, in my knee pit. So I take that ball, I'm going to turn just a bit, I'm going to place it right in my knee pit, and this is like there's multiple parts to this here. So I'm placing it in my knee pit. From here, once I place it in my knee pit, I'm going to take the leg and I'm going to be bringing the shin towards me. So what it looks like, I'm here and I'm bringing that shin and I'm going to bring it in towards me. Once I'm here, all I'm going to be doing is I'm gently going to rotate my foot out and rotate my foot in. From the front view, you'll see that I go out and go in, but that movement is driven by the tibia. This shin bone here is turning outward and is turning inward. So again, I hug it and I just start there, and usually from here, you can feel a couple of spicy spots as you're going through, but you're just trying to get some range of motion to make it easier. You can hold it out a little further. The closer you hold it in, the spicier it will be. From here, once you do that and you've kind of warmed the tissue up a bit, you're going to take the ball and you're going to take your foot and you're going to plant it down into the ground, and you're going to be bringing your hands back. Now from here, you're going to be lifting yourself away from the floor, so it's really important that when you go for the lift, that you don't go to it with a rounded shoulder position. I'm going to scoot back just a bit. You're going to want to think about pushing the ground away and thinking, hold yourself up, chest up, and push the ground away. And that way, all throughout, you're keeping this nice open shoulder position as opposed to being here and just trying to lift your hip up. So then push the ground away. Now from here, you're going to bring that bottom towards your heel, and then you can come back out of it. And as soon as you do that, you'll start feeling it intensify. To add a little bit more, you're really going to think about driving that knee as far forward as it'll allow, and then you come out of it. As far forward as it'll allow, come out of it. Usually this is where things get the most spicy, is that part there, that usually there's a tendency to only get to here and then come out of it, but really challenge yourself because you're only going to be there 1 or 2 seconds, then you come out of it. After I do a couple of reps there, I can take it and I can go into circling the leg one way and keep going in the circular motion, going all the way forward into flexion, coming back, and then I can reverse it and I can go 5 one way, 5 the other. No wrong or right, whichever direction, but every single time I come forward, I'm really thinking about trying to drive that knee forward. All throughout, I'm doing my best to keep this heel down. If you wanted a little bit more, the next part would be to find your way up to where you're kneeling, and then you can end up putting a little bit more load and helping yourself out to drive the knee forward and back by manually helping yourself push and come out of it. I can also be here and be helping myself go forward into that circle and reversing it as well. or you can be a little bit more upright, and there also adds a little bit of logo. Once you're done, you'll remove the ball, and what you usually find is as soon as you go into trying to lock the knees out, you'll feel that ability to get that whole leg and quad into full extension in comparison to the other one. Usually when you lock out, you'll see how the kneecap here is still up, and how the kneecap on the leg that you've done is nice and sunken in, and you have that terminal knee extension restored. So that is the technique for your knee pit. Again, addresses the tissues along the hamstrings and the gastroc and soleus, the tissues of the calf, and there's some little muscles in the back of the knee as well that also have get all that tension released and that freedom of movement restored. So that's a technique for the knee pit. Now, there's another thing with the knee that I wanted to touch in on, and that's getting rotational movements through the knee. So the knee is really great for, or one of the main jobs I should say, is that of flexion and extension. So the bending and straightening, but in oftentimes, I can't speak well, a lot of the times, a lot of our injuries end up coming from rotational things that happen. So there's a pivot or a change and that knee doesn't have that rotational capability in it, and usually that's where you can get tweaked or some injuries happen. So along with training flexion and extension at the knee joint, it's nice to try to incorporate the rotational capabilities of the knee. It is a hinge joint, but it should have that ability to rotate. There's, in the world of KinStretch or functional range conditioning, there's some things called knee CARs, which are just controlled articular rotations. That's what CARs stands for. It's a nice way of saying joint circles. So where you're taking your knee joint into a circle and circling both ways and really working the full rotational capability of that joint. That's what I want to go into next. I'll show you two variations. So main thing that we want is that tibia to rotate. So I'm going to be seated. From here, I'm going to be grabbing, I'm going to find a comfortable position here. So from here, I'm taking a hold of the shin, and you know how we worked on that first one with the knee pit? So we're doing the same thing here, where we really want a rotation to happen at the tibia. So it's not just my ankle doing this, but it's actually my tibia rotating side to side. So that's one, and usually just placing your fingers on your shin bones or up high, you can feel that when you rotate, you can feel that shin bone going side to side. So go for that feeling. Now from here, to get into this position, it's good to trap your upper thigh. So you're going to take your hand, if I'm doing my right leg, I'm going to take my right hand, I'm going to scoop it under, and then from there I'm going to be grabbing a hold of my left bicep. So again, that knee is bent, that same side arm is coming under, and I'm going to grab right underneath the thigh and then grab a hold of my upper arm and kind of lock myself in place, and that left hand, this hand is going to go, and I can use that to kind of feel for that tibia rotating side to side. So once I'm there, my goal is going to be to go into some leg extension. So I'm going to rotate and I'm going to go into a leg extension. When I go into this leg extension, I will never really seek having a full knee extension at the top, because that would end up meaning that that rotation is coming from my hip. So when you lock out the knee and you rotate, that rotation is all hip and that knee is locked in place. So when we do this, know that the end goal is not trying to have your knee fully straight and being able to rotate. That's a nice way to create a nice injury. So just make sure that you're going into as much extension as you can, and you'll never reach full extension. If you do reach full extension, I shouldn't say never, because there are people out there who have that range of motion. Don't reach full extension and try to rotate. Just stop short of full extension and then rotate. So what it looks like, I'm going to grab. Here, I'm going to pick a side. I'm going to rotate out as much as I can. From here, I'm going to be extending that leg up as high as it can go. Once it's there, I'm going to rotate inward and then control it down. Now, as I do this, I'm trying to create some tension through that range of motion. Again, up, rotate in, and back. And to scoop further back. And from here, again, I'm rotating outward. I'm going to lift that leg as high as I can, rotate inward, and then control it down. And if I have my fingers on my tibia, I can feel that tibia rotating out, rotating in, and down. As I do this, I kind of said it earlier, but I didn't finish my thought. I'm trying to create some tension through that range of motion. That tension will kind of create strength in the knee joint area. From here, I'm going to reverse this. So I did 5 one way. We're turning out, up, rotate in, and down. I'm going to reverse it. So I'm going to start inward. I'm going to lift up as high as I can, rotate out, and then control it down. Again, creating tension through my range of motion, anywhere upwards to 50%. So I'm really working on fighting myself as I control it down, fighting myself as I bring it in, and creating my own form of resistance as I go through this. If I wanted to add a little bit more to this, I can always add a little ankle weight, 1, 2, 3 pounds, and then that also is another way to add some resistance while I'm doing this. The whole goal is to really control it up, rotate, and then control it down. And I'm taking that knee joint and that tibia and rotating while I'm going through as much range of motion as I can. There's these things called sliders. You can use a frisbee, you can use a paper plate, like a frisbee on a carpet, or a paper plate or plastic plate can usually spin and rotate. So if I'm having a hard time feeling that tibia rotate, I can always place my heel on the little slider and be able to just dig my heel and try to rotate and rotate. And that usually helps facilitate that motion. I could be here again, I could rotate out, lift up, rotate in, come down. When I make contact, I can rotate out again and lift up. And it's just some nice feedback to kind of help teach you where that rotation should be coming from. And again, if you create strength by creating tension through that range of motion, you'll help create strength at the knee joint. And what you usually end up feeling after you do 5 one way, 5 the other, is that you'll feel like you've got a really nice warm knee joint that also has some range of motion and flexibility in it, mobility in it, but you're owning all that mobility because of that tension you've created as you've used as much of your range of motion as you can throughout the whole movement. So those are knee cars and knee controlled articular rotations, creating strength through that knee joint and accessing all his rotational capabilities. So it's a nice follow-up after you've done something with the knee itself, or done a little floss compression band around the knee joint with a little leg distraction. I have a video showing that. If you tweak your knee, that's a nice go-to to use the floss compression band. And this is just a nice follow-up to all of that, those knee cars. So give it a shot. Bye.